A patient with heart failure is prescribed furosemide. Which finding requires immediate action by the nurse? A. Potassium level of 2.9 milliequivalent/L. B. Mild ankle swelling. C. Weight loss of 1 kilogram in 2 days. D. Blood pressure 130/80 mmHg. Answer A. A potassium level below 3.0 milliequivalent/L increases the risk of life-threatening arrhythmias and requires prompt correction. A post-operative patient reports sudden shortness of breath and chest pain. The nurse suspects pulmonary embolism. What is the priority action? A. Check the patient's oxygen saturation. B. Notify the healthcare provider. C. Place the patient in high Fowler's position and administer oxygen. D. Obtain a 12-lead ECG. Answer C. Positioning and oxygen administration support oxygenation while preparing for further emergency interventions. A nurse is administering blood to a patient. 10 minutes later, the patient develops chills and back pain. What should the nurse do first? A. Slow the infusion rate. B. Stop the transfusion immediately. C. Give diphenhydramine. D. Notify the provider and continue monitoring. Answer B. Stopping the transfusion prevents further reaction exposure and is the first step in managing a transfusion reaction. Which finding indicates that a patient with pneumonia is improving? A. Productive cough with yellow sputum. B. Respiratory rate 26 breaths/min. C. Oxygen saturation increased from 88% to 95%. D. Persistent crackles at lung bases. Answer C. Improved oxygenation reflects better gas exchange and effective treatment response. Which electrolyte imbalance is most likely in a patient with chronic kidney disease? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypocalcemia. Answer B. Decreased renal excretion of potassium leads to hyperkalemia in chronic kidney disease. A patient with liver cirrhosis develops confusion and tremors. The nurse suspects hepatic encephalopathy. Which lab finding supports this? A. Elevated ammonia level. B. Low albumin. C. High bilirubin. D. Low hemoglobin. Answer A. High ammonia indicates hepatic encephalopathy due to impaired detoxification by the liver. A patient receiving total parenteral nutrition, TPN, develops a fever and chills. What should the nurse do first? A. Stop the TPN and start 10% dextrose. B. Check blood glucose. C. Replace the TPN bag. D. Assess for insertion site and notify the provider. Answer D. Infection is common with central lines. Assessing the site ensures timely management of potential sepsis. A patient with diabetes presents with blood glucose of 540 mg per deciliter, dry mucous membranes, and fruity breath odor. The nurse suspects A. Hypoglycemia. B. Diabetic ketoacidosis. C. Hyperosmolar hyperglycemic state. D. Insulin overdose. Answer B. DKA is characterized by hyperglycemia, ketone production, and metabolic acidosis causing fruity breath odor. Which assessment is most important before giving digoxin? A. Respiratory rate. B. Heart rate and rhythm. C. Blood pressure. D. Temperature. Answer B. Digoxin slows conduction through the AV node. It should be withheld if the heart rate is below 60 bpm. The nurse notes a patient on a morphine PCA has a respiratory rate of 8 per minute. What should the nurse do first? A. Stop the PCA infusion. B. Call the provider. C. Administer naloxone. D. Assess pain level. Answer A. The nurse should stop the opioid delivery to prevent further respiratory depression and then administer naloxone. A patient with heart failure has gained 3 kilograms in 3 days. What does this indicate? A. Dehydration. B. Excess diuresis. C. Fluid retention. D. Malnutrition. Answer C. Rapid weight gain indicates fluid overload due to worsening heart failure. Which of the following is a priority for a patient receiving chemotherapy? A. Preventing infection. B. Increasing physical activity. C. Limiting protein intake. D. Reducing fluid intake. Answer A. Chemotherapy causes bone marrow suppression, increasing the risk for infection. A nurse is assessing a patient with an NG tube to low suction. Which finding indicates a potential complication? A. pH of gastric aspirate is 3. B. Dry mouth. C. Serum potassium 2.8 milliequivalent/L. D. Clear drainage. Answer C. Prolonged gastric suction can cause potassium loss, leading to hypokalemia. Which intervention prevents complications after abdominal surgery? A. Encourage bed rest for 24 hours. B. Deep breathing and coughing exercises. C. Restrict oral fluids. D. Keep legs immobile. Answer B. Deep breathing and coughing prevent atelectasis and postoperative pneumonia. A patient with a central venous catheter reports discomfort at the insertion site. The nurse observes redness and swelling. What should the nurse do? A. Apply warm compress. B. Flush the catheter with saline. C. Stop using the line and report findings. D. Change the dressing only. Answer C. Redness and swelling suggest infection. Using the line could spread bacteria into the bloodstream. Which finding is expected in a patient with right-sided heart failure? A. Crackles in the lungs. B. Jugular vein distension. C. Shortness of breath. D. Orthopnea. Answer B. Right-sided failure causes systemic venous congestion, leading to jugular vein distension and edema. A patient develops urticaria and dyspnea after receiving 4 antibiotics. What is the priority action? A. Stop the antibiotic infusion. B. Administer diphenhydramine. C. Call the provider. D. Check the foresight. Answer A. Stopping the infusion prevents further exposure during an allergic reaction, followed by emergency treatment. A nurse caring for a patient with chronic pain should prioritize which intervention? A. Encourage ignoring pain. B. Establish a regular pain assessment schedule. C. Use only non-pharmacologic interventions. D. Delay medications until pain worsens. Answer B. Consistent assessment ensures timely interventions and prevents pain escalation. The nurse is teaching a patient with newly diagnosed hypertension. Which statement shows correct understanding? A. I will stop my medication once my blood pressure is normal. B. I'll limit my salt intake and monitor my pressure regularly. C. I only need medication when I feel dizzy. D. I'll check my blood pressure once a year. Answer B. Lifestyle changes and consistent monitoring are essential for hypertension management. A patient with COPD is prescribed oxygen therapy at home. Which instruction is correct? A. Use more oxygen if short of breath. B. Avoid open flames near oxygen equipment. C. Remove the nasal cannula when resting. D. Increase flow rate above 4 liters per minute for comfort. Answer B. Oxygen supports combustion. Patients must avoid flames or smoking near oxygen. A patient with hypothyroidism is receiving levothyroxine. Which finding indicates effective therapy? A. Weight gain. B. Decreased energy. C. Improved alertness and heart rate. D. Constipation. Answer C. Levothyroxine restores metabolism, improving alertness, heart rate, and energy levels. Which lab result should the nurse monitor closely in a patient taking warfarin? A. INR. B. BUN. C. Creatinine. D. Platelets. Answer A. INR measures warfarin's therapeutic effect. Maintaining a target range prevents bleeding or clotting risk. Which symptom is typical of hypocalcemia? A. Muscle twitching and tingling. B. Constipation. C. Weak pulse. D. Flushed skin. Answer A. Hypocalcemia increases neuromuscular excitability, causing twitching and paresthesia. The nurse teaches a patient with gastroesophageal reflux disease, GERD, to A. Lie down immediately after meals. B. Avoid caffeine and spicy foods. C. Eat large meals twice a day. D. Drink fluids during meals only. Answer B. Caffeine and spicy foods relax the lower esophageal sphincter, worsening reflux symptoms. The nurse notes a patient with chronic renal failure has pruritus. The most appropriate nursing action is A. Apply moisturizing lotion and avoid harsh soaps. B. Restrict fluids. C. Encourage vigorous scratching. D. Increase protein intake. Answer A. Moisturizing relieves uremic itching, while harsh soaps worsen skin dryness and irritation.